Olpruva 6.67 gram oral pellets in packet urea cycle disorder agents are used in combination with dietary changes for the long-term treatment of a specific inherited disorder known as urea cycle disorder. It works by helping to remove excess ammonia from the body. Too much ammonia in the body can lead to serious complications, including brain damage and potentially even death. It's important to note that this medication is not intended to be used for the treatment of sudden, severely high levels of ammonia in the body. If you experience sudden symptoms of too much ammonia, such as trouble thinking, nausea, vomiting, irritability, trouble speaking, trouble walking, or fainting, it's crucial to seek medical help immediately. The daily dosage and the optimal timing for taking this medication should be determined by a healthcare professional. Be sure to follow their instructions carefully to ensure the best results from this treatment. Before taking Olpruva 6.67 gram oral pellets in packet urea cycle disorder agents, make sure to read the patient information leaflet and instructions for use from your pharmacist. It's important to follow the illustrated directions for the proper use of this medication. Take this medication by mouth as directed by your doctor, and the dosage will depend on your weight or body size, medical condition, and response to treatment. The total daily dose should be divided into equal amounts and taken with each meal or feeding, typically 3 to 6 times daily. It's important not to increase or decrease your dose without your doctor's approval. To prepare a dose, mix the contents of the thickening packet into a cup with 4 ounces/120 milliliters of water, stir well, then add the contents of the sodium phenylbutyrate packet and stir again before drinking all of the mixture within 5 minutes. Make sure to add more water to the cup, stir, and drink all of the mixture to ensure you are getting the entire dose. Remember not to prepare a supply in advance and not to give through a feeding tube. It's important to use this medication regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. Some people may experience loss of appetite or menstrual changes while taking Olpruva. However, most people do not experience serious side effects. If you do experience serious side effects such as drowsiness, easy bruising, fast heartbeat, or signs of metabolic imbalance, it's important to contact your doctor right away. While a serious allergic reaction is rare, seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects, be sure to discuss them with your doctor or pharmacist. As always, it's important to follow your doctor's guidance and take the medication as prescribed. Before taking Olpruva 6.67 gram oral pellets in packet urea cycle disorder agents, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Also, it's important to discuss your medical history with your doctor or pharmacist, especially if you have certain heart problems, kidney disease, liver disease, or swelling. Since this medication contains salt, sodium, it's essential to let your doctor or pharmacist know if you are on a low-salt diet. Be cautious while taking this medication, as it may cause dizziness or drowsiness. Avoid alcohol or marijuana, cannabis, as they can increase these effects. It's best to refrain from driving or using machinery until you can do so safely. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's crucial to discuss the risks and benefits with your doctor. Additionally, consult your doctor before breastfeeding as it is not known if this medication passes into breast milk. When taking Olpruva 6.67 gram oral pellets in packet urea cycle disorder agents, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It is advised to keep a list of all products being used, including prescription, non-prescription drugs, and herbal products, and to share this list with your doctor and pharmacist. Any changes to the dosage or starting/stopping of other medications should only be done with the approval of a doctor. This is to ensure the safe and effective use of Olpruva 6.67 gram oral pellets and to minimize the risk of any negative interactions with other medications. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, it's important to call 911. Otherwise, contact a poison control center immediately. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to remember not to share this medication with anyone else. Your doctor may also request regular lab tests to monitor your ammonia and amino acid levels, as well as other blood and urine tests. Make sure to keep all your medical and lab appointments and consult your doctor for more details about these tests. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at the usual time. Don't take double the dose to make up for the missed one. It's important to store Olpruva 6.67 gram oral pellets in a cool, dry place at room temperature, away from light and moisture. Make sure to keep it out of reach of children and pets. When it expires or is no longer needed, be sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.